Coming back to the continent, 15 lawmakers and 11 members of staff at the Zambian parliament have tested positive for COVID-19. This comes days after the National Assembly suspended sittings because of a lawmaker having died of the respiratory disease. Zambia's coronavirus cases have surged to 3,856, and that's from 1,632 at the beginning of July, with deaths now rising to 136 over the 30-day period. Now, the heavily indebted Southern African country is bracing for an economic contraction of over 4% this year because of the fallout from the COVID-19 pandemic. For a little bit more on this, we're now joined via Skype by Zambian journalist Davies Sikopo. Thanks so much indeed for joining us and welcome to the program.
Thank you, Peter, and thank you for having me on this particular program.
All right, so this must be quite a scare for Parliament that you have 15 lawmakers and other staff contracting COVID-19, and this is after, of course, one lawmaker died.
Yes, it is quite a scare to most people in the country. Which is very, of course, saddening to many people around because of the surging cases of COVID-19. But just a quick one. Earlier on, the Ministry of Health announced that it was 15 members of parliament, but later the clerk of the National Assembly, Cecilia Mbewe, corrected the figures to say that it wasn't 15 members of parliament. And I just got that information just a few, about 2 hours ago, when the clerk of the National Assembly confirmed or clarified that particular issue to say it was only 5 members of parliament that tested positive to COVID-19 when they were tested. And then the other 5 members of staff at the National Assembly. And then we had also 5 non-staff members testing positive to COVID-19. So bring the total number to 15. So unfortunately, I think the figures were sort of mixed up. But otherwise, the total number of members of parliament is 5. Then the members of staff at parliament is 5 also. Then non-staff members is 5. Bring the total to 15. So the country right about now, most people, of late we haven't been seeing many people masking up. Of late we haven't been seeing people taking up all those preventative measures. But this time around, after the surge, we have seen a number of people now putting up the masks. Today I was just going around town. I could see a lot of people putting up the mask, even just in public buses. People today are putting on the masks because of the surge that has hit the country. And this surge, we are told, is because of the cold weather that the country is experiencing right about now. So the country has been experiencing quite low temperatures, hitting up to 5 degrees. That is positive 5 degrees. And of course, the highest that we could get is somewhere around 23, but obviously getting even lower than that. So that is one of the reasons why we are told that these cases are increasing at a sort of a rapid speed. As compared to the recent past, like in the month of May and of course June, early June, and the other months. So that is the current situation happening in Zambia right about now.
All right, so let's get back to this Parliament story. I mean, Parliament, I believe has about 166 members. So 5 is still quite a high number if we exclude the staff and other people that work there. Has Parliament now stayed shut? What's the position?
The position right about now is that Parliament has adjourned, and Parliament adjourned because we saw a member of parliament dying dying of COVID-19. And of course, in fact, we had the National Assembly had announced a week ago that we had 3 members of parliament that had contracted COVID-19 and were in admission. So a few days later, then we saw 1 member of parliament dying. That is on Friday last week. Then we saw another one again dying on Saturday. And the first one who died on Friday. He also had he had tested positive to COVID-19, but on 2 occasions he was tested, but he came out negative. But then after a day he was tested when he tested negative for COVID-19, like 2 days in a row, tested negative for COVID-19. He died. And according to the World Health Organization, that is all classified as a COVID death. And then the other one also was found with COVID-19, but also had other comorbidities, of course, which also made him also be classified as a COVID death. So we have got 2 members of parliament that have died of COVID-19, and we also had a nurse from the National Assembly who also died. So the issue was so heartbreaking to a lot of people around, and of course Parliament saw it fit that they could adjourn and just make sure that all members of parliament are safe. And the Speaker of the National Assembly, Dr. Patrick Matibini, had to lead, and the Speaker of the National Assembly, Patrick Matibini, and also the Vice President had to lead members of Parliament to go and test for COVID-19 because, according to the Minister of Health, only a few members of Parliament had tested for COVID-19. That is, I think, about 6 members of parliament out of the 157 members of parliament. So only 6 had tested for COVID-19. So it had to force Parliament to now just make it mandatory for all members of Parliament and all members of staff at Parliament to go and test for COVID-19. So then they tested for COVID-19, and out of those, so they tested on the 22nd for COVID-19. Then out of those that tested, 5 were found to be COVID positive, and that is 5 members of parliament were found to be COVID positive. Then we had also 5 staff members, and also we had 5 who are non-staff members that also tested on that particular day from parliament buildings and were found positive, which brought the number to 15.
All right, talk to me a little bit about the strategies that have been employed by Zambian authorities to manage COVID-19. Was there a lockdown similar to the ones that we've seen in South Africa and other countries? And is there a process where they've started to open the economy? What route has Zambia taken?
Well, as we speak, the country has sort of opened up. In fact, this time around, as we speak, measures are mostly relaxed. Some few months ago, I may say maybe some 3-4 weeks ago, we had sort of a partial lockdown, though it wasn't lockdown as you have it in South Africa, but it was just a partial lockdown where we had all airports closed. We only had one international airport working, which is the one which is based in Lusaka, the Kenneth Kaunda International Airport, which is the one which was operating. Then the others were all closed for international airlines, and of course airlines around the country were grounded because of the pandemic that we are going through right about now. So in terms of other sectors of the economy, Maybe before I go to the other sectors of the economy, so afterwards, when the president and of course cabinet saw it fit, and probably the Minister of Health saw it fit, they had to open up the airports to allow these other international airports around the country to start operating. So as we speak right about now, we have all these other international airports like Simon Mwanza and of course the other one operating, of course, inclusive with Kenneth Kaunda International Airport. Then in terms of other sectors, we had bars were closed, and of course they're still closed right about now. We also had restaurants which were shut, but restaurants, just like airports, were opened up to start trading. But of course, always encouraging members of the public or those that go into these restaurants to be observing the safety measures that are being announced by the Ministry of Health and of course the World Health Organization. That is social distancing in terms of also like washing hands, also sanitizing, and other measures. So basically, the Ministry of Health and other government bodies have stood on a platform to say that everyone should mask up, everyone should use hand sanitizer, because just recently we saw a situation where people had stopped putting on these masks. People had stopped using hand sanitizers. People just jump on public buses without caring or anything else like that. Then the public bus will be full to capacity, whereby maybe the conductor or that person who charges people when they jump on a public bus has nowhere to sit. They have to stand. Meanwhile, we had COVID. And this is because at some point, the Ministry of Health had stopped their daily updates of COVID-19. And at some point, people saw the cases sort of going down. So people were so relaxed and thought that COVID-19 was a long gone thing. And some people didn't even believe that, there was COVID-19 in the country. But this time around, when the country has been hit so much, almost everyone now is masking up. Almost everyone now is moving with hand sanitizer. Almost everyone, when they're going into these shops around in the shopping malls, everyone is carrying their masks and just putting it on as they are almost entering the shopping mall. So this time around, levels of compliance to some of those measures are sort of improving because of the situation that they have seen, and they have seen that COVID cases are sort of on a rise in the country, and because of the deaths that have been recorded and also the cases being recorded, people now have started to take those measures seriously, and even those that didn't believe that COVID-19 exists, this time around they're taking it so serious.
All right, and that's where we're going to leave it. Arthur Sikopo, thanks so much indeed for your insights and your update from Zambia. Zikomo kwambiri.
Zikomo kwambiri, siyabonga.